Hello everybody. So today's video blog is going to be on the topic of septoplasty. So septoplasty is the name of a surgery that I perform. And what this surgery entails is it's actually helping people to breathe better through their nose. So, the term for this the problem that the surgery treats is called a deviated septum. So the septum is the name for the wall in the middle of your nose that goes from the front of your nose all the way to the back on the inside. So the front, about 1/3 of the septum is made out of cartilage, and then the back 2/3 is made out of bone. But basically, it's sort of a thin layer of bone and cartilage, and on each side of it, there's a layer called the mucosa, which is kind of the lining on the inside of the nose that covers up the bone and cartilage. So, if this wall down the middle is crooked off to one side or the other, or sometimes it sort of does an S-curve and it's blocking both sides, that can block people's breathing. It makes it hard for them to breathe through the nose. I'd say most of the time the septum has been deviated from birth, but in some cases it's due to a broken nose or trauma that shifts the septum out, into where it's blocking the nose. I see these patients regularly, and I like to tell people no one has a perfectly straight septum. So just because your septum is bent or curved somewhat doesn't mean that you need an operation. So I think you need to have a deviated septum to consider having the surgery, but you also need to have symptoms of your nose being blocked up. And the symptoms need to match where the deviation is on your septum. So, if I see someone where they have a septum that's deviated off to their right side, but they tell me they can't breathe through their left side, it doesn't really make a lot of sense for me to straighten that septum. I think it makes more sense if they have a deviation to their right side, then they should, and they're also saying that they can't breathe through the right side, then the symptoms match the structural problem. And in that case, I think it makes more sense to consider treating it or fixing that problem. So there's also the thing we need to consider is a lot of times medications can work to help relieve the symptoms. So just using something like Flonase or Nasacort, which are simple over-the-counter nasal steroid sprays, they can help you breathe better. And in a lot of patients, that's enough to improve the breathing to where you don't really need the surgery anymore. But for people who've tried the medicines, they have a crooked septum and they have symptoms that are going along with that, I think it makes sense to consider having surgery to straighten that septum out. So the surgery is something that I typically perform with the patient asleep under anesthesia, but patients will wake up and go home the same day. Once you are asleep, the surgery usually takes me somewhere around a half an hour to 45 minutes. If it's a very complicated one, it may take an hour or more, but that's pretty unusual. With the surgery, I make a little incision inside of the nostril, but it's nothing you really see on the outside. And then basically what we do is just lift the lining up off of that crooked bone and cartilage, and then I'll remove the crooked spots, squish them flat, and put them back in for support. And then at the end of the procedure, I put in a bunch of stitches, but the stitches will absorb away over time. Most of the time, I don't leave any kind of packing or gauze or splints inside of the nose. Sometimes I need to when I think it needs that extra support, but most of the time I can get away without needing that. And that's nice because it makes the recovery a little less unpleasant for you as the patient. So anyway, we have, I think, some more information on my website about the septoplasty surgery. I certainly see plenty of patients for this, so if you think you have this problem or you can't breathe through your nose, come and see me and we'll get you straightened out. Have a great day.